CRTD patient has a survival of more than 80% at 7 years. And pure ICD patients living after 10 years is around more than 40%. This is because ICD patients, ICD is selected because they are probably worst heart failure patients. So even their survival is more than 40% with an ICD. And annual mortality rate for CRTD patients with moderate heart failure is 3%. So that is quite less. From a big 80% has come down to 3%, 80% at 5 years, but this is 3% annual mortality rate. And the change of ICDs, 50% of ICD changeouts are avoidable for people less than 50 years of age using an ICD of 12-year longevity. And it has been found that there's a 75% CRTD changeout is avoidable for patients more than 70 years with a 9-year longevity device. So definitely, patients are nowadays patients are getting devices earlier, and they are living longer, so they need more longer lasting devices. So it's a need that we need to have more long lasting devices. So what is being done is basically it's improvement in battery technology. That's a constant research which is going on. What is there is improvement in battery technology. What we can do to devices are either therapy dependent or pure device dependent. In therapy dependent factors like pacing output, basically pacing, the more you pace, the more is the current drain, because pacing requires more energy than sensing circuits. So basically if you reduce the amplitude, definitely you can save a lot of battery. So you need to keep the lowest amplitude possible. Pulse width is another factor, but if you see, amplitude is more important, because pulse width, even if you increase it, you can put it, if you can put it at a lower amplitude, you will be actually saving more battery. And impedance, that is another thing, which higher the impedance, higher the battery drain, because the current, to reach that voltage, you need more current. So current drain will be higher. Next is the pacing rate. Suppose you need to pace a patient for some purpose at a higher rate, average rate. Like in late heart failure, you may have to pace at a higher rate to keep the cardiac output. So in such cases, battery drain will be higher. So as advanced heart failure, sometimes you may have to pace higher and their battery drain will be higher. And of course, it depends on pacing percentage. More the RV pacing percentage, if you can reduce the RV pacing in a CRT, like if you have an adaptive bi-V CRT, then definitely the battery drain is going to be lesser. And the more you do time in telemetry, so these days we have more of remote telemetry. Suppose you use telemetry in excess, battery drain is going to be very high. So device dependent factors include the static current drain, which is not very avoidable. And suppose you switch on all the algorithms like AF prevention algorithm, then battery drain is going to be very high. So nowadays, the new devices have come up with newer battery configuration. Like Medtronic has come up with a new stack plate battery configuration. The communication energy is now Bluetooth, which requires less energy. And so there are methods to reduce current drain also. And the total battery capacity also has increased. Now what has been done in battery is that silver vanadium, it's a combination of carbon tetrafluoride and silver vanadium. And multiple carbon tetra, difluoride or etc. are used. The proportion of that depends on, that will increase the longevity. Suppose SVO, silver vanadium oxide, is a high capacitance, sudden discharge, basically came for an ICD, but endurance is with lithium. So carbon tetrafluoride, lithium is for endurance. So if you vary the proportion of these components, the battery longevity is going to increase. So there is an increased proportion of carbon tetrafluoride in the present day batteries. And then configuration also improves. Now they have come up with a stack plate battery design that gives more of 15% more energy efficient. This was the old one. It's a coil plate. It's like a plate which is coiled around itself. So this acts as multiple bipoles. Now what is done is multiple separate stacks of battery. This is very similar to EV car technology, where they use the same technology, where multiple battery packs are stacked. So that gives maximum number of separate batteries which can be connected in series with least space. So that's how EV batteries has come. So that has come in pacemakers also. It's a stack plate battery design. So that is, and another thing is the high density integrated circuit. That also reduces the battery drain and increase longevity. what happens is a microprocessor if you switch on algorithms, etc., what happens is each time microprocessor wakes up and for all calculations. So suppose the calculations are repetitive, this can be reduced. So in Cobalt and Chrome devices, what has been done is if there's a repetitive task, the microprocessor remains in the sleep state. So that markedly reduces the current drain and increased longevity. And some other features which contribute to energy conservation are, one is suppose you use a quadrupolar lead and a bipolar lead. That actually increases the longevity by reducing battery drain. Active fixation definitely improves the battery longevity, because if you do active fixation, there will be a more chance of constant contact between tissue and the lead. So that will increase, there will be a consistent impedance, consistent contact, which increases the battery life. Then all electrodes are these days steroid eluting, that definitely helps. Then capture management. Earlier we used to use safety margins, but in CRT, the good thing is that we can put a lower safety margin. Even sometimes dynamic capture threshold management, or just plus 0.5 above the capture threshold. You can program it like that rather than 2 times safety margin, because here pacing dependency is not there in CRTD. Even if you miss 1 or 2 beats, usually patient will not know. So you can afford to reduce the capture the pacing voltage just to above plus 0.5 above the capture threshold. That is another way of increasing battery life. That you can do it even in older devices, but minimum safety margin that you can program is 1.5 times the threshold usually. But in a CRT, you can, in newer devices, you can put it plus 0.5 than the capture threshold. And if you turn off atrial sensing in chronic AF, because it will be unnecessary using excess energy for sensing all the higher atrial 400 rates. So that also, if you turn off the atrial sensing, that will also increase the output in a AF patient with heart failure. So definitely the improved longevity due to electrical efficiency, improved charge transfer, improved charge efficiency, and no capacitor formation is required. And there are less of internal electrical connections. So what is done is everything is made into a single module, or advanced valve metal capacitor. So that single capacitor reduces the connections, interconnections. So definitely we are getting devices of longevity of 10.4 years, 13.4 years with ICDs and Chrome CRTs. Thank you.
Yeah. Praveen, may I ask a question? So what's your percentage of patients where you use active fixation LV lead? And what is your concern, the concern about the retrieval of these leads or removal of these leads if something goes wrong? Like infection patient with CRTD and we have put an active fixation lead. How comfortable are you in extracting these leads?
Even if it is a passive lead, I don't know whether it will come off so easily, but active fixation leads, it can be taken out. But I think it is more difficult to take out an active fixation lead than a usual bipolar passive fixation lead. Definitely it is more difficult. Second thing, regarding active fixation, something else you asked?
Yeah, that's what extraction is one important point. Yeah. And how is the percentage of patients where you are using active fixation?
These days we are using almost 95% are active fixation leads.
No, LV. I'm talking about LV.
Understood, LV.
Yeah.
Now, is it necessary that 90 such a big number of active fixation is required?
I think if you see the battery longevity, probably it is much better. And the bipolar usual passive fixation leads, you tend to have variable thresholds and all. So probably active fixation leads is much better in that term.
Yes, definitely electrically it should be better, but this most of the time anatomy is not so bad that we have to go for fixation. It is just for, your indication is just for surety that it should be stable more.
Definitely if it's a large vein, definitely active fixation leads.
No, that is all right. After assessing the coronative sinus anatomy, then we can think of
change of vein,
But if anatomy is favorable, in that also we'll go for fixation, active fixation.
Usually, again for electrical parameters, longevity and all, I think these days I prefer active fixation leads.
There is question to you and also this company people, any technicians. Is that removal is recommended? Is there any safety issue of removal? Safety is removed. If we want to remove,
I don't know. I'm not aware of any safety issue regarding removal of an active fixation lead. I didn't have to perform one so far, so I'm not very aware of the difficulty. Probably it should be more difficult than a passive fixation. And even passive fixation, I'm not very sure will it come back so easily.
Yeah, I think so passive fixation, LV lead the easiest to extract. So
Yes.
just
now most of the time it's
even
come out
without
easily, no
taking
problem.
stylus in, we can just pull it out. As these are unlike the ICD leads and all, we require a lot of pull and push and pull. But this LV lead, which is bipolar or quadripolar, whatever may be, this is easily removable.
Just concern is during this passive fixation lead of LV, if we want to remove, passing this stylet, during that time we should not kink that. That is the only precaution we have to take. If you can pass up to the last pin, it is very easy to pull out. It is very easy.
Just asking, there are new devices are coming with so many features like remote monitoring, everything.
Yeah.
So how do you plan that it will save the battery? More features, it will drain the battery.
Yeah, definitely. That's why the one battery capacity has changed. Definitely, the battery capacity itself has changed. They've added mixture of, as I told, carbon tetrafluoride plus SVO. So it's a variable ratio. So that the more you add carbon tetrafluoride, the more endurance we'll have. If you switch on more features, then definitely battery is going to be lesser than, it will be a range. So it will be in the lesser part of the range. Suppose we can switch off like atrial sensing in patients with AF, such things we can do. And the new thing is that again, if you can reduce the threshold, like safety margin is not 1.5 times in a CRT. Nowadays it is like plus 0.5, plus 0.25, plus 0.5 than the threshold which is measured. So dynamically those things are offsetting for the increased features. That's it.
Any initial safety issue regarding this coiled battery based on wire coiling and to dipole, small dipole, small batteries?
Yeah.
Is there
Basically,
any
the
safety
stacked
issue?
batteries like
Yes.
multiple dipoles.
Multiple dipoles
stacked
are-
on.
Yes. Is there any safety issue?
Not
That-
that I
besides-
know of, but because everything is hermetically caged, so it should not be a problem. Whether it was a coil design or a multiple stack issue, there will be a dielectric in between definitely. So there should not be any safety issue in that.